So very good afternoon to all of you, respected Dr. Silva Vinayakam sir, Director of Public Health, all the respected leaders from Director of Public Health, and all the people, those who have come from the different parts of the country to attend this magnificent conference. On behalf of Eco India, this is a great privilege for me that I got this opportunity, and I'm going to tell you the story today, how this Eco has changed the world in health system, how technology has entered into a way and how technology is playing a greater way in a health system strengthening altogether. So ECO stands for Extension for Community Healthcare Outcomes. This is a not-for-profit organization and we are working since 2008. But overall, the project started in 2003 under the umbrella of Project ECO at University of New Mexico by our founder, Dr. Sanjeev Arora. If you see our tagline, it's saying moving knowledge, not people. And we are more that wherever you are, you can get the knowledge so that the knowledge should reach to the last mile without putting any efficient effects and with a low dose and high frequency way. May I move slides are not moving. I will start with the code. Alone we can do so little and together we can do so much. I think this is what we all have done together in all across country with all the state governments and national health missions and corporations, and specifically Directorate of Public Health and Preventive Medicine Department of Tamil Nadu. Our focus is on capacity building of workforce and empowering the frontline healthcare workers, and a lot of our VHA and ASHA workers are all here. And you can see that what our purpose is, our major focus is let the knowledge should reach to the right place with the right time and with the right impact so that the right outcomes which you are looking into, you can get that. And we are very lucky that we have our mentors like Dr. Himanshu Bhushan, other senior leaders also here, those who have got the opportunity to interact with us in the ECO model, and we make sure that the thing should move in a right direction. We are not only into health sector, but we are also into healthcare, education and livelihood. I'll tell you, the journey started in 2008 when the trust has been created in India, and today we are in 2024. When 2008, this trust has been created in India. That time, the 2G, 3G facilities were not there. And majority of the people are still knowing that ECO is a Zoom. ECO is not Zoom. ECO has moved beyond Zoom. ECO is not at all Zoom. When 2008, this model came over in India, the Polycom system was there. We were hardly having 2G, 3G facilities. We started doing some initiative, but not successful. By the time 2015 came over, 2G, 3G facilities were available. NIMHANS came first on board. NIMHANS being the nodal agency in the field of mental health. Now they are acting as a super hub for us. Super hub means that they are now training the other state digital training academies, mental academies all across country. We are also into education. We are also into livelihood. Recently we did a partnership with Ministry of Agriculture. We also did partnership with the Ministry of Jal Jeevan Mission WASH, and we entered into the WASH also in a very extensive way. These are the Board of Trustees of ECO, and you can see who. Dr. Soumya Swaminathan, Madam belongs to Tamil Nadu only, and we have Meenakshi Datta Ghosh, Dr. Colonel Kumudrai, he is the chairman of ECO India, Dr. Arvind Lal, who is a revolutionary in the pathology sector, Dr. Subrata Acharya, Dr. H. Sudarshan. 2014, as I mentioned to you, was when the process of ECO started. And today we are in 2024. I'll just tell you the story, how it happened, the drastic change. I always say before COVID, BC and AC, these are the two eras ECO has seen. Before COVID and after COVID. Before COVID, people were not even giving the importance to the technology. How technology can act as a digital health tool. But after COVID, people realized the value of the technology and how technology can do the revolutionary changes as a digital health tool. 2019, Ministry of Health and Family Welfare, Government of India did an overarching agreement with Eco India under Ayushman Bharat, and directions has been given to all the states that if they would like to use this model, which is a case-based learning model, the ethos of ECO is case-based learning. And that's how it differs from the other platforms. That's how it differs from the other models also. And it's a model of low dose and high frequency, means you fix up your cohort size, whether it's a medical doctors, whether it's ASHA workers, or whether it's a nurses, run them with a series of the sessions every fortnightly. And you want to know the impact of the model, you have a digital infrastructure available known as iEco platform, where you can upload your pre-test, post-test, feedback analysis, and you can get the dashboards being sitting here itself. NHSRC, sir has worked in NHSRC. NHSRC came on board, sir, in 2018 itself with Eco India. Now NHSRC is acting as a strategic hub for us for running multiple initiatives through them. And CPHC is one of the program which NHSRC, Dr. GB Singh is leading from NHSRC also. Tata Memorial Hospital, which is a nodal agency for the Tertiary Care Center for Oncology, they are on ECO platform. They are on ECO telementoring platform, and they are running a national tumor grid. National tumor grid is an amalgamation of more than 300 oncology centers all across country. Every fortnightly, the oncologists sit on this particular platform, discuss the cases, get their doubts clear, and that's how it's in three-way interactions which is going to happening on this particular initiative. And it is spokes among spokes, spokes with the hub specialist, and hub specialists with the spokes also, and you will get the solution. So it's a community-based practice model which can give you the drip irrigation way, the impactful training initiatives. So what is the difference? The difference between, if you see that we are not a webinar, we are not a seminar, we are not a Zoom. Zoom has been embedded into this because we have a partnership with the Zoom CSR all across in the USA, and we are providing this free of cost in a non-financial way with all the partners all across country. It's easily replicable. You don't have to need any particular thing. You can get on your laptop, you can start the things, and the people can get the access through their mobiles, whether it's Android, whether it's Apple, you can get the links and people can get the trainings wherever. Lot of VHNs, lot of ASHA workers here in the Tamil Nadu, they are getting multiple training initiatives. I still remember we started with the COVID vaccination during the COVID-19 time when the COVID was there, and we entered into a multiple arena with the Tamil Nadu state with the help of the DPH sir. We are running now cardiometabolic syndrome initiative here. We are running women wellness program with Dr. Nirmal. We are going to start on school health initiative. We are going to start on National Tobacco Control Initiative, multiple initiatives in the Tamil Nadu state. And once we started a comprehensive healthcare package in Kalakurchi district, which is the interior more past, people were not even thinking it over whether this comprehensive healthcare package would run through ECO model or not. You'll be surprised that the 70% was the compliance rate for that. And based upon that, funder has given us the next funding, and where the second phase, again, we put it up in Tamil Nadu, and we started through Madurai, this particular initiative again. So thank you for the great work done by all the colleagues from the VHNs and the ASHA workers and ANMs for taking this model in a very big way. It's yours. This is the scale of ECO now. You see the area, you see the states, all the states we are there, and we have now more than 450 hubs dedicated to ECO model, strengthening the various capacities of various health cadres all across country with various health system initiatives. It is not only in Tamil Nadu, but it is not only the thing that we impose to the states, we ask the states, what is your need? Accordingly, we will fulfill your need and we will run the things in a more impactful way. It is not only for the medical doctors, it's for all cadres, from the grassroots level workers to the top-notch medical officers. Yeah. As I mentioned to you, we started in Tamil Nadu during the COVID-19 time. In overall, if you see during the COVID-19 time, we trained around more than 7 lakh healthcare workers all across country with more than 3,000 sessions. This happened in collaboration with Ministry of Health and Family Welfare, Dr. Veena Dhawan, the immunization team there, and the All India Institute of Medical Sciences, the ex-director, Dr. Randeep Guleria and their team. And all across country, this model trained the healthcare workers in a big way, because that time it was humanitarian crisis. Nobody was knowing how the dissemination of COVID-19 would happen. Luckily, the eco wings were already there before the COVID. And we opened up all our channels in that humanitarian crisis, and we put it up all our energy to train the healthcare workers. And that's the time when eco came in a big way. all across country, and states have started adopting that. This is the COVID vaccination program, as I already mentioned to you, which we did that. This is the COVID confidence, again, the confidence and advocacy program, because there was a lot of myths during that time which was associated with COVID, and we conducted this program, and it happened in Tamil Nadu also. We are working with National Institute of Cancer Prevention and Research also. They are acting as our super hub, and we are running multiple cancer prevention and screening program. Luckily, just few days, 1 month back, we have become the tele-mentoring platform for cervical cancer elimination India Network Consortium, which has been created in India for amalgamation among 30 top-notch institutions in the country, and we have submitted our proposal for 100 districts which Government of India is planning to take for cervical cancer screening, vaccination also. In that, ECO is going to be the tele-mentoring platform for that. That is the level which ECO has achieved now with the help of all of you. So our major purpose is not, its main thing is amplifying the institutions. If you come to know about your needs, we will help you. It's a totally a non-financial way which we enter, and we also provide the technical resources which can help you in strengthening the various health systems, sitting into your own institutions also. They are all mid-level public health cadre people, and we work purely on a philanthropic way, which we get the funding from the various philanthropic organizations and run this initiative. I'll just come to the last few slides now. TB is one of our major initiatives all across country under the NTEP program, which is one of the premier initiative of Honorable Prime Minister of India for TB Mukt Bharat, that TB Harega, Desh Jeetega. ECO is the tele-mentoring platform for overall NTEP program all across country, and we are supporting all the state governments, national health missions, union territories, and we have more than 100 hubs dedicated to TB program itself. You name the initiatives, whatever initiative we get, we work in collaboration with the partners, and we join hands with them, and they act as our front runners and champions to run our various initiatives. As I mentioned to you, we have already done partnership with the Ministry of Jal Jeevan Mission, and we entered into a big way in a wash area also. Coming to the Tamil Nadu state, these are the various eminent partners with whom we are already working, in which DPH is one of our eminent partner, and all the joint directors, deputy directors are here. My sincere thank you to each one of you for giving ECO India this great opportunity to work. And we work with organizations like MS Swaminathan Foundation, Dr. Mohan's, ICMR, National Institute of Epidemiology. These are all prominent institutions in Tamil Nadu with whom we are working day in and day out for strengthening the various activities. You can see that the journey, how it started, and the journey started with a program which was there on state level, a 1,000 days program on high pregnancy mother management, SOP, and universal healthcare services, and that was started long back. And then we started multiple different initiatives, one day, one by one, and I have multiple slides to show, but I will not show that because time is a constraint here. And we started an initiative on cardiometabolic syndrome also, and this is an initiative on women wellness program which Dr. Nimalsan was leading, and we conducted in Agmore Training Center, and we launched this initiative in Dindigul and Tirupur district. This is another initiative on comprehensive healthcare package which we started, and this is the second phase of comprehensive healthcare package which is going on in Tamil Nadu state again, where we have put it up some spoke sites and hub sites also. So you can see that DDHS Ranipet, DDHS Kalakurchi, all other various awards ECO has won, and these awards are your awards. You people have given us this opportunity to represent in various forums, and we got these opportunities that. These are the acknowledgements which we have received even from the Ministry of Health and various other people. This is my last slide now. I can only say that there is a huge to be done, and it cannot happen with a single eco only, it can happen with the investors like all of you, with the organizations like all of you, because we believe in collaborations. Nothing can happen in isolations, and that is the way eco is working day and night. So on behalf of my eco leadership, on behalf of my whole eco team, I'm really grateful and thankful to you for giving me this opportunity. And this is a humble beginning. I think there are multiple things are waiting for all of us. Let's join hands together to do more impactful work to get the right outcome for our betterment of our society. So thank you once again. Big thank you on behalf of Eco India, and big thank you for giving me this opportunity.
Thank you, sir. You have enlightened us that Eco India have paved a nice platform for capacity building for our staff up to the village level. Thank you, sir.
Thank you. Thank you.
Thank you, sir. Now we request JD Training Ma'am to felicitate the speaker.